Hey, I'm Dr. Lowenstein here in Santa Barbara, and I wanted to review a couple of things about some of our implants. I'm actually very excited because there's a new implant out called the Ideal implant, and it's a saline implant that is much more like the look and feel of these gel implants. But just to review things from the beginning again, simple saline implants are kind of like a water balloon filled with saline, and the saline inside, if it were to leak out, would be absorbed by your body, and that's a really nice thing because you can always tell whether or not your implant is intact. But as you can see, when we hold it up, it tends to ripple, and you can almost always feel this and sometimes see this, and it's one of the reasons that people kind of prefer not to use these implants. The implant that I use the most, about 80% of the time, is a smooth round gel implant. This implant feels the most like normal breast tissue. It tends to look very nice, and it moves around in the pocket very similar to how your normal breast tissue moves around in your body. So it's really going to be one of the most natural options. Another type of gel implant is this form stable or shaped implant, also called the gummy bear implant. This implant is actually textured because it actually needs to stay in place. It can't rotate because you can imagine if this implant were to rotate in your body, it would look pretty funny. So it's made to stay where we put it. It feels a little more firm, and some people like that, some people don't. So it's a very individualized choice, of course, but it's another option that we have. The new implant here is called the Ideal implant. It's made by a company called Ideal, and it's saline filled. Now, something to remember is that these gel implants, when they leak, you don't necessarily know it because your body is not going to absorb the gel. So the FDA wants you to get an MRI after 3 years and every other year after that in the case of this implant and this implant, the silicone gel implants, to make sure that they're intact. When this implant ruptures, your body absorbs the saline, and you know there's an issue because it gets smaller and one of your breasts gets smaller. So you don't have to worry about MRIs. Similarly with the Ideal implant, it's filled with saline. So if there's an issue with it, if it leaks, your body absorbs the saline, it's very safe, and you know something is going on immediately just by examining yourself in the mirror. But because this implant has what's called baffles, or multiple layers inside, the saline flows in a manner that makes it feel much more like these silicone gel implants and much more like your own tissue. It tends to ripple much less, as in really not at all. And so it's really taken the issues with the simple saline implants and improved them significantly. It's a very, very new product. It's been FDA cleared and it's been intensively researched. So I feel that it's safe and really a great product for my patients. And there's very few surgeons who are able to use these implants because there are only select surgeons in various regions who have access to them, and I'm really excited to be the surgeon who has access to these implants in Central California. I'm really excited that we have all of these different implants to share with our patients, the most options in Central California for your breast augmentation, and I'm excited to talk to you about them. Please feel free to come in and give us a call, make an appointment, and we can go over all of these things in detail. Thanks very much.